Good morning, Mr. Secretary. I'd like to respond to Dr. Harris, but I won't. Glad to see you. Thank you, Congresswoman Frankel. First of all, thank you for your tremendous leadership, and thank you for ensuring that health equity is an important cornerstone in all of our HHS efforts. With the support of our chairwoman, Congresswoman Presley, Senator Warren, in the FY22 omnibus, we included language directing HHS to submit a report that involves a detailed plan and proposal for the development of a national center on anti-racism and health equity within the department. And so following up on that, I'd like to know the steps that your agency will be taking to comply with this this requirement for its development. And secondly, just with regard to HIV and AIDS, I'm really encouraged to see that the president's budget requested $377 million increase for ending the HIV epidemic initiative and $9.8 billion over the next 10 years for a PrEP delivery program to end the HIV epidemic in the United States. So just wanted to know how you envision this program being implemented. Next, the announcement of the new HHS Task Force on Reproductive Health, the announcement, how will that be implemented? What steps are being taken? And finally, just on poverty, Congresswoman, Chairwoman Lucille Roybal Allard and myself, well, we put into the FY 2022 appropriations bill directing the Secretary, yourself, to convene an interagency coordinating council on both child poverty and comprehensive supports. So I'd like to know, in terms of your views on the development of the implementation of this congressional directive with regard to children and the interagency council.
Congressman, great to see you, and thank you for all the work you've been doing. Let me try to give you a bit of an answer, and please probe if you'd like to on any of those subjects. First, the National Center, for us, that's a priority because we know that bad health outcomes often occur not because of just your health, but because of the social determinants around you. And so we intend to move on that as quickly as we can. We will keep you apprised. We have a team that's working on that, but that was one that you had us at hello and trying to do that one. On, if you could tick off the...
HIV and AIDS in terms of the HHS implementing the program to end the AIDS epidemic by 2030.
I think you'd agree we're that close to actually finding a cure, not just keeping people alive, but actually finding a cure on AIDS, HIV, and we should go the rest of the way. And so you see the president's commitment to try to get us the rest of the way. We intend to try to fully implement that. We have teams at HHS that have been researching this, that have been implementing, that have been guiding America for a long time. They are anxious to be able to get the resources to let
Great.
let
And I have a few more questions,
Sure.
if I may get them to you in writing under this issue. But on the next two questions, in terms of the announcement of the HHS Task Force on Reproductive Health Care, which was announced, how that's going and being implemented, and finally, the Children's Interagency Council as it relates to poverty and comprehensive supports.
Again, that council, we are in the process of setting that up as well. We know we have a lot of work to do because we see how throughout the country reproductive health care rights of women are being not only enjoined but probably undermined. And so we want to make sure that we're out there trying to make sure that we're protecting their rights under the law and making sure that their health is maintained. And so we will aggressively move on that. We will work with those who are interested, including those in Congress, but we do intend to move on that one as quickly as we can.
Okay, thank you. And the final question I had was the implementation of the Children's Interagency Council that Congresswoman Lucille Roybal Allard and myself are working on.
The same there. We were given that charge recently, and so we are moving forward to try to make sure that we put in place the infrastructure to make it happen. Again, I think this is one of those where we have, whether it's at the Administration for Children and Families or any of our other agencies, HRSA and all those who would have a role in that, we're anxious to get going. We will keep you apprised and see who's interested in working with us on that.
Great. One more follow-up. I have a minute and 20 seconds left. Going back to HIV and AIDS. Okay, the PrEP program, in terms of providing PrEP medication at no cost to people who really need PrEP and don't have the resources, and wanted to find out, how does coverage of PrEP at no cost under Medicaid fit into the administration's overall goal for PrEP?
So I know that, what I can tell you right now is that we are doing everything we can to do bulk purchases, because we know for a lot of folks it's unaffordable. We do bulk purchases, we can get those treatments for far less cost. We can then make it more available to more Americans. We also are trying to make sure we focus on those who are usually left behind when it comes to these types of therapies and treatments, and we're making sure that we reach to them. I would have to get back to you on how we would handle this within Medicaid, because you know that is not a simple process of just turning the switch.
Okay, look forward to hearing from you. Okay, and finally, let me just associate myself with what the chairwoman mentioned and said with regard to our global global COVID efforts. And in fact, remind everyone that we've got to have the resources for the global COVID response. There are new variants on the rise, and I just want to remind everyone that this is a very small planet. What affects one affects all. It's in our own interest to fund both domestic and global immediately. Thank you again.
We concur.
Mr. Fleischman.
Thank you, Madam Chair. Ms. Secretary.